At this morning's event, we'll hear from researchers Professor Gillian Schofield and Dr. Birgit Larsen, who present key findings from their project and discuss the implications for policy and practice. And we'll also hear responses from Johnny Hoyle and Dr. Lisa Holmes. Just to provide a bit of background about the Nuffield Foundation, we're a small independent charitable trust with a mission to advance educational opportunity and social well-being. In doing so, we view increasingly well-being and opportunity for the most disadvantaged as our primary imperative. In the case of our work in family justice, this means improving outcomes for children and their families, and through the research that provides greater understanding of their experiences. Which brings us to the research being presented today, which explores the essential role of long-term foster carers in helping transform the lives of vulnerable children in care. The study investigates how the regulations and guidance of long-term foster care introduced in 2015 have been implemented by different local authorities across England, and in doing so, identifying good examples of good practice and suggestions for refinement. I'm pleased to introduce our chair for today's event, Dr. John Simmons, Director of Policy and Research and Development at Core and Bath. John is a qualified social worker and has substantial experience in child protection, family placement and residential care settings. He is currently responsible for Core and Bath's contribution to the development of policy and practice in social work, health and law and research. And his recent research has focused on unaccompanied asylum seeking children in foster care with the Universities of York and Bedfordshire, a study of 100 women adopted from Hong Kong into the UK in the 1960s with the Institute of Psychiatry, and a DfE-funded study on special guardianship with York University. John sits on the Adoption and Special Guardianship Leadership Board and the Public Law Working Group. He was awarded an OBE in New Year's Honours List in 2015. Before I hand over to John, just a couple of housekeeping points to note. Attendees will not be visible or audible during this webinar. After the presentation and panel responses, there will be time for a discussion to answer your questions. If you'd like to submit a question, please do so by typing it into the Q&A box. If your question is directed at someone, please indicate that. We have got closed captions in English, which you can access by clicking on the CC icon towards the screen, towards the Q&A button. And finally, the recording is being live recorded, so it will be available after the event, as will the slides for the presentation. I'll now hand over to our chair, John.
Thank you. Thank you very much, Ash. Well, I'm really delighted and honoured to be asked to chair this event today. As Ash said, the government, DfE, introduced the Care Planning and Fostering Amendment Regulations in 2015. And I think it was a huge, significant recognition of the role that foster care and the foster carer has in their day-to-day care of the child, where or whether the placement is short-term, medium-term or long-term, but particularly with those amendments, long-term recognition that long-term foster care needed to be identified for the significance of what it actually provides, particularly from the day-to-day role of the foster carer in their day-to-day care of the child. So a significant development, and of course, as with all developments, we need to gather data and evidence about both implementation, impact, effectiveness and outcomes. And it's difficult to imagine that there could be any research team more fitted to undertaking that than Jill Schofield and her colleagues at the University of East Anglia. So we're going to receive a summary this morning. The research reports and an executive summary are now available. You need to set a reasonable amount of time to explore those documents. They are detailed, but they're rich in detail and rich in identifying the issues that have arisen in those care planning and fostering amendment regulations. So we've got, first of all, an introduction to the study by Jill Schofield, and I'm sure that many of you will be very familiar with her history and contribution to the sector over many, many years. She's led many research projects on long-term foster care in the Centre for Research on Children and Families at the University of East Anglia, indeed since 1997, and a range of other studies and developments when it comes to foster care and child placement more generally. She was awarded an OBE in the Queen's Birthday Honours List 2020, and I think actually went to Windsor Castle this week to actually receive her honour, I think from the Princess Royal. So what a week it's been for Jill. Can I hand you over to Birgit Larsen, who's going to take us through the beginning slides, which summarise this this study. Birgit has been involved in the study since 2011. Again, a wide range of research projects on the pathways of children in care at the Centre for Research on Children and Families at UEA. And that includes studies both of residential care, young offenders, LGBTQ people in care, and the specific issues about this study as well. So can I hand you over to Birgit? And I think we're expecting some slides that you're going to start. Yes, there we go. So that's all worked very well. Okay, off we go.
Thanks, John, for your warm welcome. But actually, it's going to be me who's going to
be you doing the introduction. I'm sorry.
Just going to give those background slides before Birgit talks about the first part of the findings and analysis.
Of course.
Okay, well, welcome everybody. It's a great pleasure to be here and to have this opportunity to share these findings with you. So, as John said, this is an investigation of the implementation of these regulations and guidance on long-term foster care. And we had a team at UEA, accompanied by a team at the University of Manchester working on this project. Next slide, please. So in terms of the background to the long-term foster care regulations and guidance, so long-term foster care has been recognised as a legitimate permanence option in policy and practice since the 1980s, when the whole idea about permanence started to become an important driver for the care system, in fact. But long-term foster care regulations and guidance weren't introduced until 2015. So this has been a long period of time, really, in which people have wondered about the status of long-term foster care. So these regulations and guidance were an important indicator of government support for long-term foster care as a permanence option, alongside their support for other options: reunification, kinship care, adoption, and special guardianship. And I was part of the group between 2013 and 2015 that worked with some very enthusiastic civil servants on trying to make sure that long-term foster care was a respected option. Next slide, please. So in summary then, what did the regulations and guidance have to say? Well, first of all, they redefined permanence. So they kept, obviously, the main ingredients that we recognise and know, this importance of security and stability for children, but they removed the requirement for legal parental responsibility that had been in the 2010 guidance. So this was an important element of saying, actually, long-term foster carers are taking responsibility as carers in a permanence placement. Defining long-term foster care in terms of a child's permanence plan meant that it had to cover all the different elements that other permanence plans offer. But in particular, what was required was a whole area of local authority practice around long-term foster care placement, which included consulting children, foster carers and both parents, assessing children's needs and foster carers' parenting capacity to meet those needs prior to confirming a match. So this wasn't a new idea. Many local authorities had been doing this, but this now became a requirement of any placement that is to be called long-term foster care. And also the requirement to provide a support plan. I'm going to say a bit more about some of those elements later in the talks. And also to record children in long-term foster care and report in the SSDA 903 annual return to the Department for Education. So this is very important, a very important element in the new world, really, of long-term foster care. The regulations also allowed local authorities to reduce the frequency in long-term foster care placements of social work visits to a statutory minimum of 6 months, and looked after children's review meetings to 1 annual meeting and then a 6 monthly review without a meeting. Next slide, please. So in terms of the background for this study, well, as John said, we've been working on long-term foster care, its strengths and challenges for a number of years. And following the introduction of these new requirements, there was uncertainty about whether and how they were being implemented. And key also was the fact that the DfE were unwilling to publish the data that was now coming through on long-term foster care placements because they had concerns about the data quality, with some very high numbers in some authorities and some very low numbers and rates in others, which you're going to hear more about. So we were concerned the opportunity to establish long-term foster care in procedure and practice may actually be lost. So we were fortunate that funding was awarded to us by the Nuffield Foundation to explore what was really going on in local authorities. I'm now going to hand over to Birgit to tell you about the first findings. Oh, sorry, not. I'm going to tell you about the research design. So before I hand over to Birgit, just in outline, we had the analysis of the national data for England on pathways and profiles of children in long-term foster care. This is an important element. This is the element that Birgit's about to talk about. But then we also had these important elements of a national survey of local authorities with 74% returns, and also IFA procedure and practice with a fewer number. And then we did telephone research interviews with 43 service managers, fostering IROs, looked after children and data managers from a sample of 30 local authorities. And you're going to hear a lot more about that. So, but I now am going to hand over to Birgit to tell you about this analysis of the national data.
Thank you, Jill. Next slide, please. Thank you. So the quantitative analysis that I'm now going to present focused on children looked after in foster care in 4 financial years from 2014-15 to 2017-18. We use data back to 2009-10 in order to detail the child's history, but the descriptive statistics on child characteristics and the regression analysis was primarily used from data primarily from 17-18. We explored child, placement and agency factors, and the regression analysis estimated the impact of these factors, child, placement and agency factors, on the chances of a child being recorded in long-term foster care versus short-term foster care. Next slide, please. So as context to this study, we were aware that during the study years of 2014-15 to 2017-18, the number of looked after children had increased nationally, including numbers in foster care. Published figures on long-term foster care had been limited prior to our study, as Jill said, with figures not published by local authority, but those that had been published by the DfE showed a decline in total long-term foster care figures in England from 2016 to 2019, representing a decline in the proportion of children who were in long-term foster care. In 2015, the national average use of long-term foster care was 48.5%, and in 2018, it was 39.7%. We were aware from the qualitative interviews and survey that this decline may in part be due to the push for local authorities to record long-term foster care in the early years of the code. However, the published Department for Education figures suggest the numbers of children starting in long-term foster care have declined, and the numbers of children leaving long-term foster care have also declined. This means that the overall decline is likely due to a decline in long-term foster care in new placements over time. Despite this, children in long-term foster care are still a significant minority of the foster care population. And to your right, the pie chart shows the proportion of children in foster care in different placement types in the year ending 2018. Of the 40% of children in long-term foster care, 32% were in long-term placements with non-friends and relatives, and 8% were in long-term placements with friends and relatives. Next slide, please. The profiles of children in long-term foster care nationally show that there's a wide range of children in long-term foster care. We looked at the characteristics of children in long-term foster care in the last study year, 2017-18, and this slide shows at a glance gender, age, and ethnicity of children in England in long-term foster care. Just over half of the children in long-term foster care were male, and about 3/4 were white British. These proportions are roughly similar to the broader population of looked after children. Long-term foster care was used right across the age range, from very young children to the oldest. But as you can see here, the majority, 77.6%, are in middle childhood, between the ages of 6 and 16, with an average age of 8.6 at the start of long-term foster care. Few were from the youngest age groups. We found in our regression analysis that a number of children's characteristics were significantly associated with the likelihood of being coded in long-term foster care, as opposed to being coded in short-term foster care. Age, gender, and ethnicity all were associated with the likelihood of being coded in long-term foster care. Gender had a very small effect, with males being more likely to be in long-term foster care, but only just under 1% more likely. In terms of age, compared to those aged 0 to 2 years, every other age group was more likely to be in long-term foster care, with the size of the effects increasing with age. So for example, those aged 11 to 15 were 16% more likely to be coded in long-term foster care, and the 16 to 17-year-olds were 19% more likely. Compared to white British children, all other ethnic groups were less likely to be in long-term foster care. So for example, Black or Asian children were about 4% less likely, and children of other ethnicity were 8% less likely. Next slide, please. 89% of children in long-term foster care were in care on a care order, and they were most likely to have entered care because of experiencing abuse and neglect. 66.1% of children in long-term foster care were placed in foster care placements provided by the local authority. Again, our regression analysis showed that a number of these characteristics were significantly associated with a child becoming long-term fostered, even when all other factors were controlled. Children on legal orders other than a care order were significantly less likely to be in long-term foster care. For example, those on Section 20 were 10% less likely. But as the table shows you here, some long-term foster children were in voluntary care. Compared to the reason for entry into care being due to child abuse, children who entered care for 5 of the 6 other possible reasons were less likely to be in long-term foster care. The largest effect was for child behavior, with children who entered care for this reason being 34% less likely to be in long-term foster care. This might suggest that children who present behavioral challenges may be harder to find long-term foster homes for. The only reason for care entry that was associated with a higher likelihood of being in long-term foster care was child disability, with such children being 7% more likely to be in long-term foster care. Finally, compared to children in local authority care, children in private fostering agencies were 3% less likely to be in long-term foster care. There were no significant differences between local authority and voluntary providers, however. Next slide, please. We then examined how long-term foster care was being used nationally compared to other routes out of care for children, including returning home and adoption or special guardianship. This figure plots the number of children in short-term and long-term foster care and the numbers who left care each year via adoption order and special guardianship orders, which were combined in this figure, or reunification. Note that compared to the start of the 4-year period, all 3 types of permanency have declined: long-term foster care, reunification, adoption orders, and special guardianship orders. Together with an increase in care entrants, this means that the stock of those in short-term foster care has risen. However, something to note is that the combined adoption order and special guardianship order line masks differences between these 2 types. So in this time period, special guardianship orders actually rose and then fell, and adoption orders fell each year. Note also that the figures for children leaving care, adoption orders, special guardianship orders, and return home are numbers per year, whereas foster children don't leave the system, so those lines show the stock of looked after foster children. The number of new long-term foster placements per year is in the region of about 2,500, so only slightly lower than adoption or special guardianship orders. However, this is a group that's received less policy attention over the last few years. Next slide, please. When long-term foster care was compared with other permanence options, returning home and adoption, special guardianship, it appeared that there were some differences in the characteristics of the children. Long-term foster care differed from adoption and special guardianship by age, with the youngest children becoming adopted or entering special guardianship, and the next older children becoming long-term fostered. The average age of children to enter long-term foster care, as I mentioned earlier, was 8.6, compared to 4 for children who were adopted or entered special guardianship. Reunified children had the highest mean age of the permanency options, 10.4. They were more likely to be male, and this was the permanency option with the highest proportion of children who were Black or minority ethnic. Children in long-term foster care had the greatest number of children in the age group of 11 to 15, 46.3%. This suggests that the long-term foster care was the most common permanency option for children in middle childhood. Next slide, please. So in sum, long-term foster care is used for a wide range of children, but predominantly it's a permanency option for white British children in middle childhood on a care order who entered care due to child abuse. And it's the main permanency option for children who, due to their age, are unlikely to be adopted or leave care in a special guardianship order and who cannot return home to parents. Additionally, we found that there were differences in the use of and profiles of children in long-term foster care with friends or relatives compared to children in long-term foster care with non-friends of relatives, which I'll now turn to. Next slide, please. The proportion of children in long-term foster care with friends or relatives actually grew slightly over the 4-year period from 18.6% to 20.3% of all long-term foster children. Children in long-term foster care with friends or relatives had a higher proportion of girls, 49.2% versus 44.6%, and a higher proportion of white British children. Children in long-term foster care with friends and relatives also had younger children. So the mean age at the start of long-term foster care for children with friends or relatives was 6.5 compared to 9.2 for the children in long-term foster care with non-friends and relatives. 32.6% were aged 0 to 5 with friends or relatives, and only 5.6% were aged 16 to 17. Not surprisingly, they were more likely to have the local authority as a placement provider. And then finally, children in long-term foster care with friends and relatives had a lower proportion of elevated SDQ scores. This could be due to the children in these placements being younger, as I've described. It could be due to possible benefits of placements with relatives, or it could be that the children have fewer difficulties. If it's related to a reluctance to foster children with a higher level of difficulties, this could mean that in order for friends and relatives to widen the range of children they care for, support or offers needs to improve. This all suggests that the profile of children in long-term foster care with friends or relatives looks more similar to the children who are adopted or enter special guardianship. Next slide, please. Finally, we looked at the national variation in the use of long-term foster care across local authorities in England. As you can see in this figure, our data from 2017 revealed a very wide range in the percentage of foster children who were coded as in long-term foster care, from less than 10% to more than 80%. The local authorities we included in the qualitative data collection are indicated in red. And as you can see, we sampled local authorities that were across the range from high to low users of long-term foster care. This range has persisted since 2015 when the regulations and guidance were created. And it's one of the reasons why the Department for Education hasn't published much data on long-term foster care. There have been concerns about the data's validity and reliability. This raises questions about all aspects of practice related to long-term foster care, including how long-term foster care placements are being recorded nationally. Next slide, please. Finally, our regression analysis found that the strongest predictor of whether a child was placed in long-term foster care was not the child's characteristics, but rather whether a local authority was a low, medium, or high user of long-term foster care. Children in local authorities that were high users of long-term foster care were 38.5% more likely to be in long-term foster care, taking account of all the other variables included in the analysis. Surveys and interviews with managers, including data managers, suggested there were a number of issues related to decision-making and recording around long-term foster care, some of which will now be explored by Jill. So I'm going to turn this over to Jill now for the remainder of the talk. Next slide, please.
Thanks, Birgit. Okay, so I'm now going to look at the themes from the survey and interview data, and as you can hear, the range between local authorities was a question we were asking, but also the quality of the work that lay behind that data was very important for us to investigate. So in the first theme, we're going to look at the impact of the long-term foster care regulations and guidance as local authorities reported it. So the majority reported a positive impact of the guidance and regulations. They felt that it gave them a higher profile for long-term foster care as a permanence option. And in particular, there was a change in culture that was a benefit. There were also more robust procedures for matching and tracking, which was a good fit really with the new requirements that this should happen. There were more cautious responses to the reductions in social work visits and review meetings, so welcomed by some, but some reluctance amongst others. So that's an interesting element I'll come back to. But there were very varied patterns of impact, often depending on the starting point of the local authority. So for some authorities, regulations and guidance simply confirmed or reinforced existing good practice, that they were rigorous, but also child-centred, although even those authorities reported the benefits really of a culture change. For others, the changes were welcomed, but challenges remained in making the more robust procedures they were introducing child-centred. So there was a risk that they could become too rigid. So if you had a requirement for any approved long-term foster care placement for a child to actually attend, say, or participate in a fostering panel, that might not be appropriate for some older children who had strong birth family ties. So there's an issue about child-centeredness, which I'm going to keep coming back to. But for other local authorities, there seemed to be a more reluctance generally to engage with and accept long-term foster care as a permanence options and to use the procedures. And those were often the ones with low numbers. Next slide, please. So in terms of the kind of comments on this impact, positive comments would include things like, the regulations and guidance gave a clear route for legitimately accepting long-term foster care as an accepted route to permanence, but making sure that it is not taken lightly. And I think that's a really helpful way to put it. But the concerns that people expressed, even amongst service managers who were very keen to promote long-term foster care, was, could it really be recommended? Because it was a statutory intervention through childhood. There was a risk of stigma. And there was a sense that maybe it would be less stable than legal permanence. And of course, some concerns, perhaps not surprisingly, about the availability of long-term foster carers to meet the needs of the particular children in their care. Next slide, please. So then thinking about how long-term foster care was being defined and how messages to children and carers were being expressed. So these are good examples of that. So the message we try to give to the child is that this is going to be your family, the place where you're going to stay and the people you're going to live with until you're grown up. That's what permanence is. It's being part of the family. So I think you can see the richness of the elements of permanence in these descriptions, not necessarily using the word permanence with children, but that notion of trying to have an open-ended, until you're grown up, approach to the expectation of being part of the family. And that continues with the expectations of foster carers, which often focused on post-18 support. So this is an example of that. Staying put, if appropriate, but certainly staying as a member of the family, being there to support first jobs, university, Christmas, birthday as appropriate. They might not live with you at 19 or 20, but you would want to remain connected as a very significant person in this young person's life. So I think a very important message about the continuity of relationships and family membership. Next slide, please. Then there are the issues around, is there actually a hierarchy of permanence options when we're thinking about long-term foster care? And of course, there is the need to assess and rule out other options before a long-term foster care plan is considered. So birth family options such as reunification, kinship care, special guardianship will be considered first because that is part of our legislation. And then adoption will often be considered next for young children in care proceedings, for example. But again, that's appropriate to consider whether or not a placement order might be necessary. So then the question for local authorities was, but does this fact that you get to long-term foster care after looking at other options make it seem like a lesser value or a default permanence option? And most people were trying to say that that would not be the case, and yet there was sometimes a feeling that it might be perceived that way. Key factors in the choice of permanence option that we explored, very much as Birgit said, the role of age is key to all of this. But also, I think the lengthiest discussions we probably had were about sibling groups. How do you make a decision about the right option for each member of a sibling group? And a sense that courts were quite often now seemingly particularly focused on the continuity of sibling relationships. But local authorities did report that they were able both to recommend siblings to be in separate placements or to be kept together, perhaps in long-term foster care, including a young child, if they could make a good case to the court. And the other element, which obviously interacted with those two, behaviour difficulties arising from experience of trauma was talked about. And then, of course, we have this element that does make it different from other options, the fact that matching is going to be in existing as well as new foster placements. Next slide, please. So this takes us to, in some ways, the heart of the matter, really, because the issues around planning and matching and then recording long-term foster care were very key to what was the sort of vision, if you like, of the regulations and guidance. So they are expected to include, and this was being described by local authority, processes for consulting children, carers and birth family members, but also the role of reviews and panels in planning and confirming a match. And it's true to say, and it's true now, and it was true in research we've done in the past, that the majority of local authorities use a range of meetings and panels, but it's probably true to say that more local authorities, certainly from the survey, are likely to use, say, a fostering panel now to approve a long-term fostering match than might have been the case maybe 10 years ago. But there are issues for local authorities as to who attends each of these meetings, what are the sort of types of participation, who recommends and decides, and also is there any overlap between, for example, the review and a permanent planning meeting. Each local authority really ought to have a clear route through that they can describe not only to the practitioners, but also to families. The role of the senior manager and decision maker in planning and matching was also very important. And this kind of rather crucial element, which sounds like it shouldn't be, but actually it's quite significant. Celebration certificates and letters. How do you indicate that the making of a long-term foster care match, the commitment really of the local authority and the family, right through to adulthood, are you going to mark it in the same way as, for example, adoption is marked? And I think what came out of all these discussions was that it was very important that this was specific to each child. And good authorities were, I think, really looking at their processes for matching and the matching documentation to actually include what might this particular child who has perhaps strong feelings about their birth family, or as one manager put it, just doesn't want a fanfare, how can they also be recorded as long-term foster care placements? So in summary, there needs to be rigour, but also flexibility and child-centred sensitivity in procedures. And then, of course, that has implications for which children are confirmed or coded as long-term foster care for the DFE submission. And as we looked at different authorities in relation to this, and it certainly seems as if there is an interaction between practice and coding that is contributing to this, these differences across local authorities. Next slide, please. So to turn then to this tricky issue, I think this was new in relation to social work visiting. So the fact that this flexibility was welcomed by some is certainly evidenced in our study, that some local authorities felt that it would normalise a child's family life, and I think that was the intention of the drafters of this this guidance and regulation. The majority of local authorities had actually, 73%, had said that they reduced visits for some, but generally few children in long-term foster care. But most actually mentioned reducing it from 6 weekly to 12 weekly, not the 6 monthly that was actually allowed in 2015. And this isn't helped really by the fact that the 2015 guidance is confusing on this. So it has two categories: formally agreed as a permanent placement intended to last until the child is 18, which has a statutory minimum of 3 months, and then long-term foster placement, which has a minimum of 6 months, with the agreement of the child being of sufficient age and understanding. But given that long-term foster placement is defined as a permanent placement intended to last until the child is 18, this is obviously, in my way of thinking, a drafting error, and we are recommending that the DfE have a look at that and think about how that can be reworded. Overall, though, there were concerns about reducing frequency, both in terms of the corporate parenting role, safeguarding, promoting the welfare of children, but also the value of social work relationships with children in care, and many children in care saying, well, actually, we would like to see our social worker more. If it's a social worker that's consistent and can really support me, then I want more, not less. So there was a need to focus on, this was the local authority's conclusions on this matter really, on improving social work visits. So maybe if you're trying to avoid intrusiveness, how can we make that happen and include the sort of the range of contacts in long-term foster care alongside formal visits. Next slide, please. In terms of review meetings, so 45% said that they'd implemented a reduction, so fewer from the IRO survey, but again, often in a very limited way. And this IRO manager comment was fairly typical. Where there's agreement that it's in the child's interest, there is a light touch review at 6 monthly points, and then they meet annually, but that's a small number. And IROs reported that a review without a meeting can actually be more work through requiring multiple face-to-face meetings. Now, it could be that that is actually of benefit. So there seemed to be a need really to identify good practice in both reviews with meetings and those without. And it felt in some local authorities, even in say 2019, so 4 years after the implementation, that local authorities were still starting to get to grips with this. So again, it's another area for local authorities to look at. Next slide, please. And then finally, in terms of the themes, the data recording and management issues. So clearly, because recording had become an issue, we looked at the varied ways of working, but also the levels of confidence in the data within local authorities. And this raised a number of issues around recording long-term foster care, when and by whom, and also the software systems that local authorities were using, sometimes changing to new ones, which also caused its own difficulties. And it did seem as if data on long-term foster care placements were not always accessible to service managers. And in particular, there's this issue about, are they recording a plan or actually a matched placement, which meant that some managers were actually having their own separate spreadsheets in order to monitor the children in their teams. So this is still an issue that needs addressing. But key was a sense of a shared ownership of the data between data managers and social work managers. And both talked very positively about where that was the case, but also where they could operate quite closely, data managers and practitioners too, around the importance of data. Next slide, please. So obviously one of the purposes of this analysis was to think about, was there any identifiable links between high, medium and low long-term foster care rates and these other procedure and practice factors. And it seems that certain planning and matching procedures such as permanence planning meetings were found in high, medium and low tertile authorities. So it was very difficult to say that there was a particular link between rates and any one aspect of procedure. However, when we looked at the very low and the very high, it did seem to be the case that a combination of factors may be making a difference. And of course, that wouldn't be surprising. So if you have negative attitudes and culture towards long-term foster care, maybe you have a lack of trust in matching. One local authority said, we don't need a piece of paper, and uncertain recording practices, who's responsible at what stage in the process, did seem to be associated with authorities with very low rates. So the question then with low rates is it a matter of recording or is it a matter of practice that's producing these low rates? But with authorities with a very high rates, it could be that there's good practice in long-term foster care and in other permanence options. So children were leaving to other permanence options outside the care system as well. But it may be that very high rates are because local authorities may be recording foster placements almost automatically as long-term after a year without the required assessment and matching processes. So the numbers are one thing, but actually it's the procedures and practice and the child sensitivity that lies behind it that really has to be looked at a local authority level. So it's quite clear that local authorities with the same percent, and this could be the medium level as well, of course, at all levels, may have very different quality of practice. And that's something that the local authority needs to look at. And we're going to argue, we think that Ofsted should also include that in their inspections. Next slide, please. So as a summary of the positive results from the survey and interviews, we think that it is clear that there is a raised profile of long-term foster care as a permanence option, and it's something that managers can refer to and to look at the detail of all of that. It seems that it has generated a greater focus on systems and practice in long-term foster care, planning, tracking also, matching, support planning, very important, and of course the recording. And I think it introduced the possibility of a more flexible approach to frequency of social work visits and review meetings, which may have spurred on thinking about the quality of both in long-term foster care. So long-term foster care practice covers such a range of issues that need to be paid attention to in combination. Next slide, please. So in terms of the challenges remaining, so I've selected some of our key recommendations that you can find in the report and the executive summary. It is important to maintain long-term foster care as a positive option alongside reunification, kinship care, adoption and special guardianship. And that means at all levels, including politicians, because sometimes the care system can be viewed negatively when there isn't the celebration that we need to see of the many successes of long-term foster care. It's important that resources are available, and that's both nationally and obviously at a local authority level, giving children social workers the skills, the time and the supervision to do this obviously complex work, recruiting and supporting foster carers who may become committed to long-term foster care or who indeed may become foster carers in order to provide a family for a child long-term. Supporting birth families is a key element in all of this, and of course, mental health and education support. So achieving care planning and matching procedures that are rigorous. And by rigorous, I mean they are paying attention to the needs of the child and the needs of the foster carers, as well as the capacities of the foster carers, sensitive to those individual children's needs, views and experience into adulthood. And of course, involving foster carers and birth families in those discussions. And it's important, just as an overall point really, as the Care Inquiry said so strongly, to value continuity of relationships of all kinds in childhood and into adulthood. Next slide, please. So I wanted to end on this point, which is about the story, a long-term foster care story. And this is somebody I've called Melanie. She was age 15 at placement and age 25 when I interviewed her in 1999. And she said to me, "They were just brilliant. They turned me right around. Without them, I wouldn't have the life I have now." Melanie is now 47, a loving mother and grandmother, and still regularly and closely in touch with her foster family, as she has been for the last 30 years. And Melanie and her foster family gave me permission to use this story in talking about long-term foster care. So that's a celebratory story about long-term foster care, but it's also about the social work decisions. A social worker, when Melanie was 15, thought, let's give her a chance in a family who can offer her that support into adulthood. And that decision changed her life. And I think it's a great story. And I'm going to end on that. Thank you very much indeed.
Thank you so much, Jill. There's a lot of really important issues, material, evidence, data in what you summarised in a relatively short period of time. But it says so much about recognising the advantages that have come from those changes to the regulations, but also the challenge locally in making sure that they focus specifically on what we know every child needs. A family where they feel that they belong, where they feel that it is their secure base, etc., etc. And as you said, you summed it up beautifully in that final specific example. We're going to move on to two responses from Johnny Hoyle and Lisa Holmes. I'll just say a bit more about them in a sec. Can I just say, if you've got any questions that you want to put to Jill or Birgit, or indeed anybody else, comments you want to make, there is a question and answer box at the bottom of your screen. It's on the right-hand side, and that we'll use that to raise questions with the research team. So if you've got questions, do put them there, and we'll try to make sure that that we get them asked and answered. And so two responses, just brief responses, 5 minutes or so. But the first is going to be from Johnny Hoyle. He's had a positive personal experience of long-term foster care and is currently the Leaving Care Manager and Child Permanence and Family Reunification Development Lead in North Yorkshire. And he's also a trustee for Core & Voice. So the voice of experience, experts by experience, which have been a very important part of the care review, but we know that that's something that many people have used their experience to inform us about the significance of the issues that we're actually discussing this morning. So over to you, Johnny.
Thanks, John and Jill and the team for this really important piece of work. I think what I was hoping to do was just to share with you all a really small part of my journey. By the time I became fostered for the last time, I'd been the recipient of 2 failed kinship care placements. I'd come ridiculously close to being adopted, and that broke down. I'd, on 5 separate occasions, ceased to live with my mum, my siblings, and so the emergency one-night foster placement with the 2 most wonderful people that I ever kind of by chance came across, Odette and Trev, was the point where things changed for me. You know, I was 12. You think about you know, the things that 12-year-olds go through, the things that I'd been through up to that point, and the things that you think somebody of that age should go through. So emergency one-night placement, knock on the door, go and meet these people, and then, you know, and then the social worker sits and kind of talks about you and who you are and all that type of stuff. And once that was done, we started to get to know each other, and we realized that we quite liked each other. Now they were approved for a different age group to me, so I didn't fit their criteria. They weren't particularly used to looking after young people that were heading into teenage years. And so initially it was, you know, you're just going to stay here tonight, and then the day after was Friday, so there was nowhere else for me Friday. You're going to stay there for the weekend, and the weekend became, you're going to stay here for the next week. And eventually it got to a point where we'd almost joined forces and started to say, we actually quite like each other, and we'd like to give this a chance. By that point, having experienced all the things that I'd experienced, what I really needed was somewhere to kind of have a secure base, somewhere that I could be and concentrate on all of the other things that you have going on as a teenager. I wanted to concentrate on going to school, having friends, being able to, you know, play football or hockey or do all of the normal things. And actually that's what long-term foster care gave to me. It gave me an opportunity to focus on the things that normal children in normal situations were able to do. And my foster carers they made a commitment and stuck with it. They still stick with it. I recently tweeted a picture of my foster mum loves to bake, and she literally popped around one day and she made us a tray bake of caramel shortcakes, and I tweeted it, just kind of saying, actually, you know, these people are really special, and you know, they made a commitment and they stuck to it. And you know, remarkably, we ended up with about almost 500,000 views of this caramel shortcake, to which, when I told her, she was staggered. I mean, she cries at adverts on TV, so she, you know, she was in floods of tears at the idea that loads of people knew her. One of the other parts is that bit about a sense of belonging, somewhere that you belong to. And in my foster carer's house, nobody had kind of their own names. There was no hierarchy. Their birth children didn't call them mum and dad. Everybody had nicknames. And so the point where it was agreed that I was allowed to stay was the point that I got a nickname. And at the point that I had a nickname, we were just part of the gang. So here we are, you know, 20 years later, they belong to me, I belong to them. And I think, as much as the conversations around reunification and family and almost that idea that long-term foster care hasn't had the publicity that it deserves, I'm hoping that by reading this, by hearing a little bit about my story and my caramel shortcakes, that people will see that it was exactly what I needed. It was the thing that changed my entire future and my children's future, because they inherited a nanny and a granddad.
Thank you, Johnny. That you'll see in the chat that it's acknowledged for the how grateful we are that you've been able to share that, and it is a moving story, and it conveys that message, that kind of fundamental message that we all need to grasp hold of and recognise in whatever role we specifically have in the system. You've summed it up for us in 5 minutes, and thank you very much for doing this. For doing that. I'm going to move on quickly to Lisa Holmes, who is going to give her perspective. Lisa Holmes works at the Rees Centre, which was established quite some time ago now at the University of Oxford, focuses a whole range of issues when it comes to child placement and children in care, and she has a significant international research expertise in using data specifically to understand and promote the well-being of children in care. So her comments on this study and all the issues that come out of this study. How are you going to sum that up in 5 minutes, Lisa?
So thank you, John. Yeah, I'm not quite sure I can, and you really don't need me to be repeating what Jill has already said this morning. So I think for me, it's just a few reflections which I fed back to the team previously. And I think first and foremost, and not really a surprise from an academic perspective, I just really want to thank and congratulate the team for producing such a valuable mixed methods study, which I think we really need in the children's social care sector. It shows a depth of understanding around what sits behind the administrative data, and it gives us a sense of the nuance and complexity and variability in the system in which we are all working. So, you know, huge thanks and congratulations to the team. As we've already heard this morning, there's a huge wealth of key messages and learning, so it's been quite difficult to choose. So I've gone with my initial reflections from when I got early sight of the report, and really thinking about how we take some of these key learning points forward. So first and foremost, for me, it really adds to some of the existing evidence and discussions that we have around hierarchies of placements. And as Jill has already said, the sort of the recognition to a certain extent of the need to go through some of those sort of hierarchies, but actually understanding the implications of those in terms of perceptions of the value of long-term foster care and what that means for those working in long-term foster care, what it means for those foster carers and for those children and young people. I was also really struck by the terminology around long-term foster care rather than permanence, and how that was seen as a way of facilitating an understanding that long-term foster care meant that the foster carers were still being supported by the local authority. But I think the bit that really struck me was that that terminology was seen as a way of perceiving the placement and the foster carers as facilitating work with the birth family. And some of the people that are joining this morning will be aware that I've been evaluating family rights groups Lifelong Links for the last few years. And for me, that finding really resonated with Lifelong Links, which is very much about trying to establish connections and relationships for children in care and closer working between birth families and foster carers. We've already covered it this morning around the variability and balance of visits, the social work visits, and thinking about the purpose and the quality of interactions between social workers and children and young people. And my last comment, which I'm sure will be as no surprise to many people, is for me, this really sort of raises the questions around understanding the value of long-term foster care and the resource implications, and really thinking about value for money for the longer term. Because if we have stories like Johnny's and there are other young people, then long-term foster care and remaining within the sort of the children's social care system in a placement is the right thing to do for some children and young people. And I'll stop there.
Okay, thank you very much, Lisa. That's really helpful. And we've got a series of questions. We've got 3 questions in the question and answer box, and I know some of the issues in the chat are just comments, particularly about Johnny's contribution, which has been acknowledged as being really important. But let's just go to the question and answer. So I'll read out the questions, and whether it's Jill or Birgit or Johnny or Lisa to be answering those questions, if there are answers to those questions, we'll see how we get on. We've got a relatively brief length of time, and I'll also look in the chat to see if there are specific questions or issues being raised there too. So the first question comes from Alice Sutherland. What are the main implications of the study findings for the training and support of foster carers? So the training and support of foster carers.
Okay, well, as it happens, Fostering Network are currently revising Skills to Foster, and I'm hoping that long-term foster care, in the way it's described from the very beginning for foster carers, includes that notion of being a family for a child. I think it's quite difficult sometimes when foster carers are being trained to capture both the essence of being a professional, but also the potential for being a parent. You're skilled, you're respected, you're part of the team around the child, but also being a parent at the same time. And I think trying to get that right in how we train foster carers, both in the initial training and also in the longer term training. And sometimes it's quite difficult to get that balance right, but I'm hoping that with the new Skills to Foster, we will have that. But more generally across the sector, that this combination of professional and parent are not contradictory. We need both in long-term for successful care of children in long-term foster care.
Okay, thanks, Jill. And then from Jane Collins, I'm a long-term foster carer and run a not-for-profit supporting fostering families all across the UK. I cannot see any surveys or interviews with foster carers in the data. So the question is, why is this?
I think we were looking very specifically at how local authorities were doing the planning, just to see whether or not anything had changed since 2015. Obviously, there are a lot of other organisations surveying foster carers. We've just had that State of the Nation report from Fostering Network. So, and over the years, we have talked to many hundreds of foster carers. So we are very clear about the foster carer voice being very important. And I think it's possible now that we've seen from this bit of research that there has been active implementation. It could well be that we need to look again at some core local authorities who have good experiences that will enable us to learn direct from foster carers about how some of these things are working for them. But it's an important point, and we do take account of all the research that's come out of surveys with foster carers.
Okay, and this is a question from Claire Pritchard. What is the expectation around delegated authority versus parental consent, particularly when in proceedings?
Okay, well, I think most local authorities, we did ask this question about delegated authority. Most local authorities did indicate that, and it's in the guidance as well, that special consideration would be given to delegated authority, generally in long-term foster care. When a child is in proceedings, they wouldn't at that point be an agreed long-term foster care placement. That would still be being determined by the court. So I imagine there are obviously still issues around sometimes where proceedings may last a long time, where foster carers do get frustrated that they're not able to make certain decisions. So I guess they have to be treated with respect as a member of the team around the child while cases are in proceedings. And then when things move on to long-term foster care, then I think things would expect to shift quite significantly in relation to delegated authority.
Mm. Actually, there's just been a judgment handed down from the court specifically in relation to the to COVID and the vaccination of a boy of 12, where the parents objected to him being vaccinated, and who had the who could actually decide that. I mean, one of the things about that judgment is the boy himself, as a 12-year-old, had very strong views that he wanted to be vaccinated. But of course, there was still the issue about what delegated authority or parental duties and responsibilities were that applied in that situation. Anyway, the court judgment said that the boy's views were strong enough. He was 12 years old, and he did go on to be vaccinated. But it's an interesting judgment about those issues about who decides. Specific issue like that, but more generally, that comes up as an issue about sort of who decides and whose views should be taken into account. Then I've got this is Kate McKinley. I would be interested in views between long-term foster care and adoption for children who are at the cusp of age, identified as 5, 6, 7 or 8, from a sibling group, and have strong birth family identity and mutual love. So I suppose this is something of the kind of the challenge of these issues about long-term foster care and the specific ways that we come to understand the significance of that, particularly in those issues where there are brothers and sisters, and age becomes well, we know that age is a determining factor in whether adoption actually becomes the plan for the child. But particularly those complexities where the older child may be 5, 6, 7 or 8, and should they be placed together with a younger child for adoption, etc., etc. It's a part of the complexity and challenge of care planning, isn't it? Trying to sort those issues out and take into account the various factors that are expressed directly by the children themselves.
I would say that issue remains possibly the most difficult issue facing planning, around children, because it requires assessment of those children's needs throughout childhood. It requires a lot of attention to be paid, as that question mentions, in relation to the birth family. And of course, there are challenges there for adoption as well as for long-term foster care. So I think obviously issues around how we can make adoption more open to the idea of contact. If there are positive birth family members who have something to contribute, that might be a way to resolve that. But also, I think a lot of attention being paid to, and this is not straightforward, I know, and it's a struggle to get the balance right here, but how we can promote those continuing relationships regardless of the placement of siblings. But it isn't a straightforward one, obviously.
Thanks, Jill. And then Elizabeth Fraser. Oh, no, sorry, this is Rosie Edwards. I think there's a huge misconception from the public that foster care is short-term and adoption is long-term. As a social worker, it can be really difficult to find foster carers to commit to long-term placements. Many only want short-term placements. How do you think we can attract more long-term foster carers? There's a question.
Well, I suppose there has been a bit of movement in the idea that it should be possible to recruit long-term foster carers who come into fostering with that in mind. I think traditionally it's been very much, and some long-term foster carers have sort of complained about that, that you need to be approved as a short-term foster carer, and then when you've kind of practiced, as it were, for a while, then we can consider you as a long-term foster placement. I think that would have been said quite commonly some time ago. I think now seeing a bit more flexibility around that. But it is, I think everyone's agreed, it is a major thing to take on a child with multiple difficulties, the age of 6 or 7, and commit yourself to saying, I will always be there for this child, however their behaviour turns out, whatever's going on in my family. And I know we ask that of adopters, but it is a big ask of adopters as well as long-term foster carers, because so much is uncertain in children's lives, really. I think all we can do is do as we're trying to do, really, and as John has done so in an exemplary manner this morning as well, really. The whole idea of people need to hear the stories about long-term foster care, because I think on the whole, it's not out there so much. I think very often we hear much more about broken placements and multiple placements and so on. We don't hear enough about the positive outcomes, and perhaps that might inspire new long-term foster carers to come forward.
John, could I just add into that? Because I do wonder, Jill, whether there's space to promote the other side of the coin as well, which is, what do my carers get from me? Aside from, anytime they've got any technical difficulties now, I'm the first person they call to go and fix the skybox on their computer or mobile phones. But, they enjoy spending time with me and my family, and they spoil my kids rotten, and my kids love it, but they love it too. They get to go and walk around the park, and actually the fostering role has ended, but their lives are probably fuller as a result of having us in it.
It's the reciprocity of the relationship. It's not just one way, is it? And I think that it absolutely is not one way. That it's the pleasure, the excitement, the feelings that that are stirred up for you as you've just expressed it. And in some ways that's a kind of normality of grandparenthood and all the rest of it. But why? That's the richness of long-term, of foster care as well. It's what foster care actually get. I mean, sometimes I think are we allowed to put that into words, that foster carers have those kind of strong positive feelings and get so much out of it themselves? But it's as you've just expressed, it can be fundamental to the sense of those lifelong relationships and what they actually mean to everybody. Actually, the other thing that I had raised there's a big adopter recruitment campaign been going on for some time now, with the development of a lot of materials, including podcasts and filming of people with direct experience. And I have said to various people about, I think there would be significant advantage in looking at that material to see whether it actually could be used to stimulate a better picture about the nature of long-term foster care. I mean, obviously all of those people are specifically adopters, but the messages, I think, are still quite strong.
But I think it wouldn't be very hard. I mean, we do have some on the Secure Base website, some foster carers talking, but not specifically about long-term long-term foster care. I think it would be great to have some resources. And in fact, Skills to Foster is going to have a much stronger digital kind of presence. So resources and so on like that. So I think that would be really fantastic to think about doing that, because you have to hear these stories, because it goes against the public perception of, you know, most foster care being short-term, and also that children in care are so challenging. You know, why would you take that on, rather than thinking about the sense of the rewards are extraordinary.
Johnny, Elizabeth Fraser has asked a question which maybe links to what you've just said, but it also has a specific focus to it too. So she says, I'd like to know from Johnny how he feels about the difference between long-term foster care and adoption in his case, and how being in long-term foster care rather than being adopted has affected relationships with his birth family. Are you okay for addressing that, Johnny?
Oh, yeah, absolutely. I mean, I think when I look back to that time, there was so much stuff going on that, you know, there were a whole bunch of people that wanted to see me on top of going to school, seeing your friends, playing out, that what I really wanted and needed was to belong somewhere, and to know that the same place that I got out of bed was going to be the same place that I got into bed that same night. And, you know, I think it's hard for people that have not experienced it to really understand how strange it was for me to come home from school and my tea was cooked, and it, you know, literally all I had to do was drop my bag and sit down and eat my tea, and then I could get changed and go out and play. So I think for me then, the difference between being adopted and being fostered was minimal. I think the feeling that I belonged somewhere, that I was part of somebody's group, was probably the most important thing for me. I think for all of us, it's really important to remember that aside from the, you know, rules and processes, there are children that still need to be children in all of that stuff, and we've all got a role to play, I think, in keeping those bits in mind. So you know, as much as it is a shame that I wasn't adopted in a legal sense, I was absolutely more than adopted in an emotional sense. And then I guess the last part of the question was, how did it affect my relationship with my birth family? This probably sounds the wrong way around, but actually it gave me the strength to push some people away that I needed to be further away from me. But also, a year after I went to live with Odette and Trev, my younger brother became looked after, and he eventually came to live with us, and he is part of our gang as well. So for Chris and I, our journey could have been very different had it not been for that, you know, that one chance meeting, them taking a shine to me taking a shine to them, but also that commitment to, let's give this a try. And then, you know, and then on top of that, not only did they get, you know, a younger version of me who caused all the challenges that teenagers do cause, but then they kind of also recognized that it was important for me that Chris and I lived together, and we did, you know, we lived together for the rest of our childhoods, and now, you know, we are a group together.
Yeah. So it's so I think it's an important distinction between the kind of the legal nature of adoption and what you're describing as the kind of human relational side of it's the kind of relational bond, isn't it, that you're describing, that adoption can create a framework in, but we're discussing kind of whether long-term foster care can also create that framework. And I think that you conveyed very strongly in terms of your individual experience that indeed it can. I'm afraid we're running out of time, and maybe I can only take one more question, and there are quite a few other questions. Anyway, let me just start with that. This is the last question, so it's a thank you from Kate Gillen. If the study is extended, would it be possible to have international comparisons of permanence options for children? So an international perspective.
Well, I think the UK should be very proud of itself. We are pretty much unique in having both adoption and long-term foster care. So I think we are very strong in that. So we learn both from countries who don't have adoption, for whom long-term foster care is really the only permanent route outside birth family. It's something we could certainly look at. Systems are so very different. But we do constantly look at what other countries are doing and how they are valuing the relationship experiences in foster care and what foster care can give. And I think on the whole that the UK holds up pretty well, but like everybody else, every other country, we do need to believe in it, we need to resource it, and we need to make sure that children get the best they possibly can when they come into foster care.
Thanks, Jill. I'm afraid that that's brought us to the end, and I mean, it's not a surprise at all that there is so much to be discussed and reflected on and learnt from this study. You know, just in the question box itself, it's very clear that there's still so much we have to think about when it comes to these issues, and that's really important. You know, but part of that, you know, we've been or Jill and her team have been in contact with Josh McAllister, and it's definitely it's on their agenda. So we'll see what use they make of it. But I know they're very responsive to emerging findings, etc., etc. And I suppose the other issue, and I mean, maybe this is for discussion with at UEA with Jill and with others, is whether there are other events that might be arranged to return to and explore some of the issues that are being raised as a result of this study. But anyway, that needs a bit more discussion, but it's very clear there's a lot to be discussed, and there's a lot to be learned from this study, and you know, that's exactly what we wanted. So can I thank you very much, Jill and your team, for doing what they've done, and we've briefly covered a range of very important issues over the course of the last hour or so. Keep our fingers crossed that we'll continue to do that in a way which is going to work in enabling the importance of long-term foster care to be recognised as an option for some children in the right circumstances. That's the most powerful part, I think, of what the message is that we take away from this. So thank you very much to everybody for joining. I think, well, as I said at the beginning, that the full report is available. It's an executive summary that's available. And I think that the recording of this event is also going to be available online as well. That's right? Does that come from Nuffield, or is that a UEA issue?
It would be on Nuffield's site. I think Molly did say that she would be available on the website.
Right. Okay. So do access that material in a way which is helpful to you. We're very, very grateful that you've joined and participated in this event this morning, and our very best wishes to you all as we approach the uncertainties of Christmas, but our very best wishes for the next 2 or 3 weeks in finding a new way of kind of celebrating our relationships with each other. So thank you very much indeed.